Hey, welcome to the Morning Medical Update Weekly Recap with Medical Economics. My name's Austin Luttrell, and these are the top stories in medicine this week. Your genes might have a lot more to say about your lifespan than your habits do. A new study published in Science this week looked at Swedish twins and families with multiple centenarians and found that genetics play a pretty significant factor in how long we live. The takeaway is pretty blunt. If all of the oldest members of your family don't make it past 80, you're probably not stretching that to 100 just by eating more salad or going to the gym. Now, obviously good habits still matter, but the really extreme ages seem to belong mostly to the people who already won that genetic lottery. One professor broke it down pretty simply in the New York Times, saying some of us are driving a Mercedes and some of us are driving a Yugo. Next, prosecutors just got a guilty plea in a $52 million genetic testing scam. According to the DOJ, Florida lab owner Sean Alterman admitted to running a Medicare fraud scheme built around unnecessary genetic tests, using his labs to buy doctors' orders with kickbacks and send out misleading faxes to trick physicians into signing off on tests that their patients didn't really need. Those labs billed $52 million to Medicare and made roughly $36 million. Alterman himself personally pulled in $5.5 million through two shell companies, Shiv and Shank LLC, I'm serious, and spent it on a mansion and a 2022 Rolls-Royce. He now faces up to 15 years in prison and agreed to give up the house and the car. Finally, immigration enforcement near hospitals and clinics is putting patients and clinicians on edge. The American Medical Association warned this week that Immigration and Customs Enforcement, or ICE, operations around healthcare facilities are scaring people away from care. This, of course, comes following the shooting of Minneapolis VA ICU nurse Alex Preddy. National survey data from last year already showed that many immigrant patients are delaying or skipping care because they're worried about enforcement and data sharing. Now physicians and nurses are saying what they're seeing on the ground lines up with those numbers. So practices need a plan before agents show up. Here's immigration attorney Katie Russell from an episode of our Off the Chart podcast about what to do if ICE or other law enforcement officers walk into your practice.
What I always tell my clients, whether they're individuals, corporate clients, medical practices, the most important thing to do is to have a plan in place. So as an initial thing, I always say that every medical practice should designate a specific staff member, like an administrator or a member of the HR team, as the point of contact for any type of law enforcement interaction, and that's including immigration officials. This person ideally would be trained to review and verify any warrants presented or paperwork, communicate with the ICE agents professionally and effectively, document the encounter, and make sure that there are follow-up steps, such as communicating with legal counsel or an immigration attorney about what transpired during that visit.
But that's it for your Morning Medical Update Weekly Recap. Check back for more stories on Tuesday, Wednesday, and Thursday mornings, and I'll see you back here next Friday with the week's top stories.